Good morning. Welcome back to my session of lifestyle medicine and lifestyle intervention. My name is Dr. Chitra Paul Victor. I am a diplomat of American College of Lifestyle Medicine and International Board of Lifestyle Medicine. My purpose and goal is to bring an awareness to you about lifestyle intervention, how lifestyle intervention can change your life, how lifestyle intervention, just doing a proper lifestyle, eating right and sleeping right and avoiding various harmful, toxic products can extend your life and reverse many diseases. So thank you for staying with me for my previous session. If you haven't watched them, please go back and watch them. Today I'm going to talk about a very, very important topic about stress. It's very common. People say that I'm so stressed, my work is so stressful, my job is stressful, my family is stressful, my kids are giving me a lot of stress. So you hear that commonly. So it's become like a normal cliche for many of us. But have you really paused and thought that what stress really can do? You won't believe. Today I'm going to talk some of the physiological changes takes place because of stress. And you may be wondering, I thought lifestyle is all about food and exercise and physical activity. No, lifestyle is everything. How you make your lifestyle productive and holistic. So stress is very important. We talked about in our first session that how the mental health and emotional well-being is very, very, very effective. So stress is part of the emotional well-being. The emotional well-being can go out of balance if we are not properly taken care of. You won't believe that according to American Psychological Association, which is a study done, 70% of the primary visit, like people who goes to the doctors for the primary regular checkup, 3 months, 6 months, 1 year, 70%, 7 out of every 10 patients are related to stress related and lifestyle issues. Can you believe that? So the emotional distress is really associated with a lot of physical illnesses, diseases like diabetes, heart diseases, and hypertension. They are all associated with stress. And there is a study prove that depression have a direct correlation with stress. It will be very interesting to see that how what is happening in your body, the stresses triggers these diseases. And remember that stress is the key factor for emotional well-being. If you're happy or if you're sad, if you're depressed, there is always an underlying cause for stress. And stress is linked to many illnesses because, like I said, there is emotional involvement, like a brain and body physiology, hormones, and all the other regulations are related to many illnesses. Stress patients, the most important why I am talking about is if we all decided to follow lifestyle intervention, if we are stressed, we cannot participate in healthy lifestyle. When you're so stressed, so depressed, so down, so low, you can't have a motivation to do exercise, motivation to eat right, motivation to be happy. So remember that many chronic conditions are directly associated with stress. So if you are one of the persons think like, hey, I'm so stressed, it's a time for you to pause and take an inventory of your life. So what exactly is stress? Because everybody says, even a 5-year-old say, I'm stressed with my homework. So what exactly is stress? Let me give you an analogy. Like, you are working in your garden, like I work in my garden all the time, working in your garden. Suddenly a snake comes in front of you. It could be just a garden snake. What is your reaction immediately? Immediately your body goes into this, sudden alert mode, okay, a stressful mode. Okay, or maybe if you go back to in the olden days, ancient days, people work in the jungles and forests and suddenly a lion come, a bear come, or a wild animal come, it's coming to attack them. What happened? Immediately fight or flight reaction. Your body immediately goes into that reaction and you started, either running away or fighting against it, or somebody comes and put a gun on your head. What happens immediately? Everything in you, that's not the time you go to sleep. Everything, you become alert. That is exactly what stress is. What happened exactly? It's like a same effect like a fire alarm in your house or a security system. Nowadays everybody have a security system. What happens? A burglar comes in, immediately the security system in your house or a fire alarm in your house picks up that signal and it alerts wherever it needs to alert. Either it alerts the cops or securities or whoever, whatever. That's exactly happening in our body. So I wanted to talk a few scientific terminology. Bear with me. It may be too scientific for you, but just bear with me because this will really help you understand why not having stress is important in your life. In our body, there is a place called hypothalamus, which is a little piece in our pituitary gland in the brain. Okay, so hypothalamus actually, whenever we are stressed, whether it is work-related stress, you may be thinking, but we don't have a lion or a snake or a burglar coming or putting somebody gun. You know what? The scientists proved it. This is what you needed to stay with me. Scientists proved that our body reacts. Body doesn't differentiate between a snake and a thief and a lion or just a work-related stress. Just having a few kids in your house and getting ready to school. You're a mom staying home. That could be the same effect as some high-profile CEO of a major 500 companies, because your body doesn't differentiate type of stress. It responds to the triggers of stress. So the hypothalamus in your pituitary releases something called corticotrophic hormones. These are all the stress hormones, okay? This corticotrophic hormone then signals your body, and then your adrenal gland. Adrenal gland is what your fire alarm. The adrenal gland immediately releases the stress hormones, or also known as a cortisol, okay? So the cortisone immediately, cortisones are like a cortisols, like, all those hormones, epinephrine, norepinephrine, cortisol. Remember those three hormones, even if you don't remember anything. Those are all called stress hormones. These hormones are released by our adrenal gland into our bloodstream, okay? They just mix into our bloodstream. Okay, good. This all happens. But when the danger is when we are consistently in your chronic stress, our body has a mechanism of adapting it, okay? So your body is going to be in a high stress level all the time. When you have a high stress hormone, your body is going to be in a high stress level because of the stress hormone. So, okay, now you know what happened. So what exactly these things do? They impair cognitive performance. They dampen thyroid function. They affect the blood sugar. In other words, if you have a blood sugar problem, they can put you in a high blood sugar level. And it can decrease bone density. Wow, that's even dangerous. And it can affect your sleep hormones, so you will have a sleep problems. It reduces your muscle mass. So you're losing weight, you have no idea why. Maybe you're stressed. And it increases your blood pressure, and it reduces the immune function because those stress hormone in your blood system constantly. There is another study even proved that it's a wound healing. People with the chronic ulcers, the wound healing is lower, and it increases the abdominal fat. Why that is important? You're gaining belly fat, because belly fat is associated with the heart diseases and stroke, and it increases heart attacks, and it increases stroke, and also it increases the high cholesterol like LDL, and it reduces the good cholesterol, which is LDL. Above all, there are a lot of studies prove that there is a depression and stress is a direct correlation. There is a direct association with stress hormones, okay? And also there is another study proved that it's very important to understand that there is a study showed that I found this very fascinating. There is a place in your brain called hippocampus, okay? This is a memory center. This is a main hub of learning and memory, okay? The study showed that when they took a patient and did the MRI on this patient, they found that more than 14% reduction in the size of this hippocampus with hippocampus of the people with high level of stress hormone. There is a direct correlation. People who are in chronic stress and then they have a high level of stress hormone, cortisols, and they found that the learning and the memory center is a reduction in size. What happened exactly to the hippocampus is, it's like a tree growing. What happened, you need a big space for the tree to grow so that the roots are going into that. But when there is a high level of stress hormone, it suppresses the hippocampus, the center in the brain, which is a memory and a learning function of your brain. It stagnates it, and it stops producing a new net connections, okay? So the memory and learning center is affected because of stress. Is the trigger something? Maybe a dementia, maybe Alzheimer's, maybe all those things. We don't have answers, but scientists prove so many studies. You can do any search you want. There are so many studies prove that increased level of cortisol decreases serotonin, which is a happier hormone that leads to depression, which also affects your learning and memory. So There is a lot of medical information I shared with you because this is very important for my part 2, which will be next week. Please stay with me because next week we're going to talk about how can we handle some of this. How can we reduce stress? Because you want to live long, you want to live happy. It's not like you just want to live. You want to live happy and productive. You can take care of, American College of Lifestyle Medicine says, if you really wanted to be happy, have purpose in life. So find out what is your purpose today. Okay, find out. It could be very small purpose, maybe helping somebody, helping someone to cross the street. Find a purpose, that would reduce your stress level. So next week we're going to talk more into the stress because this is the most important topic. Thank you for staying with me. This is Dr. Chitra Paul Victor. I'm a diplomat of American College of Lifestyle Medicine. I best wish you the best for the healthy living. Thank you.